Hi everyone, this is Dr. K. I wanted to talk about a recent study from Ireland about vitamin D. These researchers, I think they polled some clinics in nearby areas in Europe, and they came to the conclusion that taking vitamin D on a daily basis may help with COVID. So they noticed that the patients or the people who are really sick or in the ICU and who have the cytokine storm, they have like really low vitamin D levels compared to people who had COVID and who didn't have complications. So based on that, the authors are suggesting that maybe vitamin D has a protective role. We know from previous research, especially related to flu, back in 2017, there was a review article published, and that showed that vitamin D levels can correlate with immunity, especially around the flu. So people who have high vitamin D levels can have, good immunity, and they're at less risk for dying from flu. We also know that people with darker color, high candidate, people with darker color and compared to white people have low vitamin D levels, and they need more vitamin D compared to Caucasians. So chances are, people with darker color have more mortality from COVID-19 because of that. Again, this is one theory. Unless we have a prospective study, we will not know for sure. But I would recommend taking at least 5,000 or 10,000 units on a daily basis until you can get over this COVID season. And also you can get vitamin D naturally from sunlight if you have sunlight exposure. Obviously, if you're living up north in New York City and other places, there's less sunlight, and it may not be conducive to go outside, so you have to take vitamin D orally. Now, one of the issues is like a lot of patients take vitamin D as a general supplement, even before COVID-19 came around. The problem is if you don't take enough calcium, there's in the metabolism, in the hormonal system, the vitamin D and the calcium, they go together in a lot of hormonal systems. So if you're not giving enough calcium to the body, the vitamin D may not work properly. So you should also look at taking calcium and probably some magnesium and other trace minerals. So that's briefly, what I want to talk about vitamin D and COVID-19. Tomorrow I'm doing a yoga session on Zoom. You feel free to sign up for that. I'll post the link below in the comments area. It's from 6 p.m. to 7 p.m. I'll focus on the lungs this time. I'll also teach you some deep breathing exercises in addition to the postures, and at the end we'll also do a meditation. So I'll strongly invite you for that. You can sign up on the Zoom link. And if there's any questions, how to reach me, you can send me a DM. I look forward to talking to you all again. Have a wonderful night. Okay, bye.